As a periodontist, I can say gum disease is a silent disease. That means that the infection happened without knowing it because patient doesn't have any pain. Basically, gum infection happen because we all have a gap, or we call it as like a space between gum and tooth. Usually it's 2-3 millimeter depth. That means when you brush, floss, or when you go for regular cleaning, you can clean it up and you remove the bacteria and nothing happen and everything get stable and healthy. But most of the time, we are all human. We miss maybe 1 or 2 areas, especially in the posterior of the mouth, that is really hard to get clean. Then the bacteria have a chance to stay there long enough in order to cause inflammation, puffy gum, and we call it as gingivitis or gum disease. As long as patients go back to routine oral hygiene, brushing, flossing twice a day, and get the cleaning, they can easily stop this at this level. However, if they don't address it at this point, then the infection gets deeper and deeper until it gets to the bone around the teeth and they start destroying the bone, and we call it as periodontitis, or also people known as gum disease. So when it gets there, gradually start destroying the bone around the teeth, and eventually the teeth become loose and patient can easily lose them without even noticing that this infection started several years ago. There are different approaches to treatment of gum disease or gingival disease based on the severity of the disease. The first one, which is very conventional treatment and very less invasive, is scaling and root planing, or also known as deep cleaning. We usually recommend to people at least have once or twice a year deep clean to make sure there's no bacterial left below the gum, so it doesn't get worse if there is an inflammation. The next level would be gum surgery, or we call it as osteosurgery. Osteosurgery means because the bacteria, they went all the way deep, then we need to have a direct access in order to remove it. So in osteosurgery, we basically remove some part of the gum, because the goal is we kind of reduce the depth of that gap in a way that it's cleansable by when patient floss or when they get regular cleaning. But with the help of technology, right, these days we have more conservative treatment approaches. We call it as LANAP, or laser assisted new attachment procedure. We don't basically cut the gum, we don't suture it. In LANAP, we use laser energy. We kill the bacteria with the help of laser energy, and we just remove the diseased inner layer of that area. Then we go with another ultrasound tip, and then we remove the bacteria and calculus that basically attach to the tooth. So after we clean up the teeth surfaces, then we use patient own blood in order to seal the area, and that give a chance to the body to defend and reconstruct the rest. If you feel like when you brush, floss, you feel like blood coming in your mouth or in your toothbrush, or you feel like you have a puffy gum or bad smell, these are some of the signs or symptoms that you can just don't take it lightly. Just make sure you can always call us at Soltani Periodontics and Implant Dentistry, make an appointment. We do a complete exam, and we have different options for you based on your choice and priority. Your concern, if it's like fear, anxiety, or pain, we address all of them based on the approaches that we have in our practice.